Hello, everybody. My name is Dr. Emery Pitcel. I am the owner and chiropractor of Rothrock Chiropractic and Rehabilitation in State College, Pennsylvania. Very kindly joined today by Dr. Maggie Sopic. She owns ReCenter Chiropractic and Wellness. Did I get that right?
Chiropractic Wellness and Functional Medicine. It's a long name.
Okay,
It's
sorry.
Yeah, you did
but
great.
If you remember chiropractic, ReCenter Chiropractic, you probably are
Yes.
going to get like the hit on Google and everything. So what we're going to go over today is, in our practice, I am a Certified McKenzie Method Provider. You may have seen on our channel that we demo and show a lot of the exercises that are in our exercise packet handouts. But with the whole McKenzie protocol, there is actually doctor, or as they phrase it, clinician-assisted progression, because everything is called progression of forces. What we try to do is try to have the patient get as well as they possibly can with their own exercise and their own pressure first, because that's what convinces us that we've set them up for self-empowerment and the ability to get themselves better outside of the practice. But what's nice still to do is to sometimes apply a little bit of doctor clinician assistance, so we could speed up that time frame and also kind of just have patients leaving here feeling like, hey, we did a little bit more than just showed you an exercise and said, okay, see you in a week, right? So what I want to start with is actually the jaw. The TMJ problem. A lot of times we can classify a TMJ problem as being a derangement at the jaw. And the best way to think about that is not nailing down what specifically is wrong at the jaw, but thinking that one of those condyles on one of these two sides of the joints is just not resting the way that it should. And so the directional preference is what's going to move that joint, recentrate that to take that additional extra pressure and pain away from that joint, kind of take pressure off the disc that's in there, the nerves that pass by, the muscles like the masseter and the temporalis, and just improve the overall pain and function at the jaw. A lot of times what we find is it ends up being a lateral shear movement. So Dr. Maggie's going to help me demo a little bit, but basically what she would do is she would, let's say for your case, you need to do a shear over to your right.
Okay.
So you would make the contact on the left part. It'd be right about here on the mandible. And then you can also block your temple on the other side. You open your jaw maybe to about like where you could get maybe a finger width in there.
Okay.
And then what you do is you just kind of do a little overpressure and you push across like that. So one of the things I could do is hold for 2 to 3 seconds and then bring that off. One of the things that I could do in here is I could just stand right in front of her, go over her hands, and add a little overpressure. Are you okay with that, Doc?
Yep.
All right, let's do one more just for demo. Awesome. So we could do it that way, or what's even better is if we get Dr. Maggie laying face up and on her back, then that actually allows her to relax her jaw and we can shear and move even more. Perfect. So go ahead and take the table here, please. Back. There we go. And again, we're going to demo. This time I'm going to demo for the sake of the video. I'm going to demo a left shear. So my contact is going to be on the right over that way. So that way you all can see it better. But what would happen is I would still once again tell her that she's going to open up that jaw, maybe to the point where she could get a finger width in between her teeth. And then we're going to make a contact here. And I tell her, relax, let me do all the work. But if we start to touch something that's like a 4 out of 10 pain, we can live with that. But if I keep pushing and you're like, oh, that's about to become like a 5 or a 6, because you're open at your mouth and because we're doing that, you're not going to be able to tell me stop too much. I usually say raise up your hand or like some sort of lift a finger to tell me no more, right? So just for the sake of exercise, do like a pseudo, all right, that would be my 4 out of 10 and show maybe kind of what that would look like, all right? Okay. So kind of open here, block in the head, and then I make a contact here, and then we're shearing kind of across like that. And just kind of creating a little overpressure. And then let's say in theory I'm going, that's her 4 out of 10, then she would kind of tell me 4 out of 10 by like raising up a hand just to like talk to me and tell me, okay, don't push any more than that. Perfect. And then we can do this 6 to 10 times and really kind of help things along. I'll do your other side because I'm sure you probably don't like that I'm just stretching the heck out of the one side of your jaw there. So it looked like that. Again, just kind of me leaning in, kind of having my hands being sort of parallel to each other, so that way we're creating equal shear and equal force across both of those. So that is one of our McKenzie doctor clinician assisted techniques to kind of progress for TMJ problems. Yes, chiropractors can work really well with TMJ issues, not just myself, but Dr. Maggie Sopic. She's with ReCenter Chiropractic. I'm with Rothrock Chiropractic, both here in Center County. Thank you so much for watching, and we hope to talk to you guys again soon. Take care till next time.